Here's some frequent misunderstandings about how to do exposure and response prevention. The first one is just do it. Exposure has to be done the right way, meaning that you have to do exposure with the right perspective. If you decide to just do it, it's true that the task will be achieved, and for some people in some circumstances, that in and of itself is important. However, just facing the fear does not mean that you're willing to experience the thoughts, sensations, and behavioral urges that accompany the fear. If you continue to resist against those thoughts, sensations, and urges, whatever task you're attempting will feel very burdensome. Fighting against the urge to avoid and trying to ignore fear, sensation, and catastrophic thoughts will become exhausting. The right attitude to embrace during exposure is one where catastrophic thoughts, uncomfortable sensations, and the urge to avoid are all expected and understood as part of the process. They are not signs and they don't have meaning. When they arrive, you don't fight to make sure they don't get worse. Rather, the attitude towards your thoughts, feelings, and sensations is, yes, I was hoping this would happen. I usually avoid, but I know what's happening and I'm not doing it this time. I'm staying with this and it's going to feel great afterwards. The second misunderstanding is I already exposed myself to what I fear. The issue here is experiential avoidance. In this case, you have been embracing just do it for some time, and you wouldn't consider completely avoiding because you care too much about the task. However, if you interpret anxious thoughts, sensations, and urges as dangerous, then you can be sure that you're using experiential avoidances to keep your anxiety at bay. Examples of experiential avoidances include worrying, safety behaviors, reassurances, and checking. The third misunderstanding is that exposure isn't curing your anxiety disorder. If you are engaging in exposure and not getting relief from your anxiety, assessing your attitude towards that exposure is important. Are you using the exposure to make the anxiety go away? Do you have the hope that if you practice exposure enough, you won't feel anxious anymore? Exposure should be used to learn the attitude of acceptance. It's a lifestyle, not a technique. If exposure exercises are not changing your attitude towards anxiety, they are unlikely to help you get long-term relief from it.